HIV, the virus that can lead to AIDS, remains one of the largest epidemics in the world today. AIDS was first identified in the United States in 1981. 3 years after scientists identified AIDS, they discovered its cause, HIV. It's believed that HIV-1, the most common form of the virus, spread from chimpanzees to humans. Hello guys and welcome to Microbiology Insider. If you're new to this channel, I do videos about disease caused by microorganisms and microbiology lectures in general. Before I ride on, please do endeavor to hit the subscribe button and turn on your notifications so whenever we upload a video, you'll be the first to know about it. In this video, I will be covering the following objectives. What is HIV and AIDS? The symptoms of HIV and AIDS, the causes, how does HIV becomes AIDS, how HIV can be prevented, and the various methods of diagnosis of HIV and AIDS. HIV stands for Human Immunodeficiency Virus. It's a virus that damages the cells in your immune system and weakens your ability to fight everyday infections and disease. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood and from illicit injection drug use or sharing needles. It can also be spread from mother to child during pregnancy, childbirth, or breastfeeding. AIDS, which stands for Acquired Immunodeficiency Syndrome, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus. There is no cure for HIV and AIDS, but medications can control the infection and prevent progression of the disease. Antiviral treatments for HIV have reduced AIDS deaths around the world. The symptoms of HIV and AIDS vary depending on the phase of infection. The first phase of infection we will be looking at is the primary phase of infection. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary or acute HIV infection, may last for a few weeks. Possible signs and symptoms of the first phase of infection include fever, headache, muscle aches and joint pain, rash, sore throat and painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, and night sweats. These symptoms can be so mild that you might not even notice them. However, the amount of virus in your bloodstream is quite high at this time. As a result, the infection spreads more easily during primary infection than during the next stage. The next phase is the clinical latent infection phase. In this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not have any symptoms or infections during this time. This stage can last for many years if you are not receiving antiretroviral therapy. Some people develop more severe disease much sooner. The next phase of infection is the symptomatic HIV infection phase. As the virus continues to multiply and destroy your immune cells, the cells in your body that help fight off germs, you may develop mild infections or chronic signs and symptoms such as fever, fatigue, swollen lymph nodes, which is often one of the first signs of HIV infection, diarrhea, weight loss, oral yeast infection, shingles, and pneumonia. The last and final stage of HIV infection is progression to AIDS. Access to better antiviral treatments has dramatically decreased deaths from AIDS worldwide, even in resource-poor countries. Thanks to these life-saving treatments, most people with HIV today don't develop AIDS. Untreated HIV typically turns into AIDS in about 8 to 10 years. When AIDS occurs, your immune system has been severely damaged. You'll be more likely to develop diseases that wouldn't usually cause illnesses in a person with a healthy immune system. These are called opportunist infections or opportunist cancers. The signs and symptoms of some of these infections may include sweats, chills, recurring fever, chronic diarrhea, swollen lymph glands, persistent white spots or unusual lesions on your tongue or in your mouth, persistent unexplained fatigue, weakness, weight loss, and skin rashes or bumps. Causes of HIV. HIV is caused by a virus. It can spread through sexual contact, illicit injection drug use, or sharing needles, contact with infected blood, or from mother to child during pregnancy, childbirth, or breastfeeding. HIV destroys CD4 T cells, which are white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. So, how does HIV become AIDS? You can have an HIV infection with few or no symptoms for years before it turns into AIDS. AIDS is diagnosed when the CD4 T cell count falls below 200 or you have an AIDS-defining complication such as serious infection or cancer. How HIV spreads. To become infected with HIV, infected blood, semen, or vaginal secretions must enter your body. This can happen in several ways, such as by having sex. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter your body. The virus can enter your body through mouth sores or small tears that sometimes develop in the rectum or vagina during sexual intercourse. Also from blood transfusions. In some cases, the virus may be transmitted through blood transfusions. Hospitals and blood banks screen the blood supply for HIV, so this risk is very small. The risk may be higher in low-income countries that are not able to screen all donated blood. Also, during pregnancy or delivery or through breastfeeding. Infected mothers can pass the virus on to their babies. Mothers who are HIV positive and get treatment for the infection during pregnancy can significantly lower the risk to their babies. The virus can also be transmitted by sharing needles. Sharing contaminated injection drug paraphernalia puts you at high risk of HIV and other infectious diseases such as hepatitis. How HIV doesn't spread. You can't become infected with HIV through ordinary contact. That means you cannot catch HIV or AIDS by hugging, kissing, dancing, or shaking hands with someone who has the infection. HIV isn't spread through the air, water, or insect bites. Complications associated with HIV. HIV infection weakens your immune system, making you much more likely to develop many infections and certain types of cancers. The first infection we will be taking a look at is pneumocystic pneumonia. This fungal infection can cause severe illness. Although it declines significantly with current treatment for HIV and AIDS, in the US, pneumocystic pneumonia is still the most common cause of pneumonia in people infected with HIV. Secondly, we have candidiasis. Candidiasis is a common HIV-related infection. It causes inflammation and a thick white coating on your mouth, tongue, esophagus, or vagina. We also have cytomegalovirus. This common herpes virus is transmitted in body fluids, such as saliva, blood, urine, semen, and breast milk. A healthy immune system inactivates the virus and it remains dormant in your body. If your immune system weakens, the virus resurfaces, causing damage to your eyes, digestive tract, lungs, or other organs. Another infection associated with HIV and AIDS is cryptococcal meningitis. Meningitis is an inflammation of the membranes and fluids surrounding your brain and spinal cord. Cryptococcal meningitis is a common central nervous system infection associated with HIV caused by a fungus found in soil. We also have toxoplasmosis. This potentially deadly infection is caused by Toxoplasma gondii, a parasite spread primarily by cats. Infected cats pass the parasite in their stools, which may then spread to other animals and humans. Toxoplasmosis can cause heart disease, and seizures occur when it spreads to the brain. Lymphoma is the first cancer we will be talking about. This cancer starts in the white blood cells. The most common early sign is painless swelling of the lymph node in your neck, armpit, or groin. Secondly, we have Kaposi sarcoma, a tumor of the blood vessel walls. Kaposi sarcoma usually appears as pink, red, or purple lesions on the skin and mouth. In people with darker skin, the lesions may look dark brown or black. Kaposi sarcoma can also affect the internal organs, including the digestive tract and lungs. Finally, we have HPV-related cancers. These are cancers caused by human papillomavirus infection. They include anal, oral, and cervical cancer. Other complications associated with HIV and AIDS include neurological complications. HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety, and difficulty walking. HIV-associated neurocognitive disorders can range from mild symptoms of behavioral changes and reduce mental functioning to severe dementia, causing weakness and inability to function. We also have wasting syndrome. Untreated HIV and AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. We also have kidney disease. HIV-associated nephropathy is an inflammation of the tiny filters in your kidneys that remove excess fluid and waste from your blood and pass them to your urine. It most often affects Black or Hispanic people. Finally, we have liver disease. Liver disease is also a major complication, especially in people who also have hepatitis B or hepatitis C. There is no vaccine to prevent HIV infection and no cure for HIV or AIDS, but you can protect yourself and others from infection. To help prevent the spread of HIV, consider pre-exposure prophylaxis. The combination oral drugs emtricitabine plus tenofovir disoproxil fumarate and emtricitabine plus tenofovir alafenamide fumarate can reduce the risk of sexually transmitted HIV infection in people at very high risk. Pre-exposure prophylaxis can reduce your risk of getting HIV from sex by about 99% and from injection drug use by at least 74%, according to the Centers for Disease Control and Prevention. The FDA recently approved cabotegravir, the first injectable pre-exposure prophylaxis to reduce the risk of sexually transmitted HIV infection in people at very high risk. The injection is given by a healthcare provider. After the first 2 monthly injections, cabotegravir is given every 2 months. The injection is an option in place of a daily pre-exposure prophylaxis pill. Your healthcare provider will prescribe these drugs for HIV prevention only if you don't already have HIV infection. You will need an HIV test before you start taking any pre-exposure prophylaxis. The test should be done every 3 months for pills or before each injection for as long as you are taking pre-exposure prophylaxis. Your healthcare provider will also test your kidney function before prescribing Truvada and continue to test it every 6 to 12 months. Other regular testing may also be needed. You need to take the pill form every day or closely follow the injection schedule for cabotegravir. They don't prevent other STIs, so you still need to practice safe sex. Another method of prevention is to use treatment as prevention. If you are living with HIV, taking HIV medication can keep your partner from becoming infected with the virus. If you make sure your viral load stays undetectable, a blood test doesn't show any virus, you won't transmit the virus to anyone else through sex. Using treatment as prevention means taking your medication exactly as prescribed and getting regular checkups. The third method of prevention we will be talking about is the use of post-exposure prophylaxis. If you've been exposed to HIV, if you think you've been exposed through sex, needles, or in the workplace, contact your healthcare provider or go to the emergency department. Taking post-exposure prophylaxis as soon as possible within the first 72 hours can greatly reduce your risk of becoming infected with HIV. You will need to take medication for 28 days. Also, use a new condom every time you have sex. Use a new condom every time you have anal or vaginal sex. Women can use a female condom. If using a lubricant, make sure it's water-based. Oil-based lubricants can weaken condoms and cause them to break. During oral sex, use a non-lubricated cut-open condom or a dental dam. Also, tell your sexual partners if you have HIV. It's important to tell all your current and past sexual partners that you are HIV positive. They will need to be tested. If you are pregnant, get medical care right away. If you are HIV positive, you may pass the infection to your baby. But if you receive treatment during pregnancy, you can significantly cut your baby's risk. Also, use a clean needle. If you use a needle to inject illicit drugs, make sure it's sterile and don't share it. Take advantage of needle exchange programs in your community. Consider seeking help for your drug use. Diagnosis. HIV can be diagnosed through blood or saliva testing. Available tests include antigen antibody tests. These tests usually involve drawing blood from a vein. Antigens are substances on the HIV virus itself and are usually detectable in the blood within a few weeks after exposure to HIV. Antibodies are produced by your immune system when it's exposed to HIV. It can take weeks to months for antibodies to become detectable. The combination antigen antibody test can take 2 to 6 weeks after exposure to become positive. We also have antibody tests. These tests look for antibodies to HIV in blood or saliva. Most rapid HIV tests, including self-tests done at home, are antibody tests. Antibody tests can take 3 to 12 weeks after you are exposed to become positive. We also have nucleic acid tests. These tests look for the actual virus in your blood. They also involve blood drawn from a vein. If you might have been exposed to HIV within the past few weeks, your healthcare provider may recommend nucleic acid test. Nucleic acid test will be the first test to become positive after exposure to HIV. If you receive a diagnosis of HIV or AIDS, several tests can help your healthcare provider determine the stage of your disease and the best treatment. These tests include CD4 T cell count. CD4 T cells are white blood cells that are specifically targeted and destroyed by HIV. Even if you have no symptoms, HIV infection progresses to AIDS when your CD4 T cell count dips below 200. We also have viral load. This test measures the amount of virus in your blood. After starting HIV treatment, the goal is to have an undetectable viral load. This significantly reduces your chances of opportunist infection and other HIV-related complications. We also have drug resistance. Some strains of HIV are resistant to medications. This test helps your healthcare provider determine if your specific form of the virus has resistance and guides treatment decisions. We've come to the end of this video. Before you leave, please do endeavor to hit the subscribe button and turn on your notification so whenever I upload a video, you'll be the first to know about it. You can also follow us on all our social media handles: Instagram, microbiology_insider, Twitter, microbiology_TT, and Facebook, microbiology